Good evening, everyone. I'm Amy Kem. Welcome to Advancing Cancer Care with Penn State Health. Tonight, we're taking you inside the brand new Penn State Health Cancer Center at Hampden Medical Center, a center built to bring hope, healing, and innovation to the West Shore. For the first time, patients can find comprehensive cancer care under one roof in Cumberland County, from diagnosis and treatment to research and survivorship, all backed by the strength of Penn State Health and Penn State College of Medicine. We'll talk with the experts who helped make this center a reality, learn how early screenings and genetic testing are saving lives, and see how Penn State Health is helping you take charge of your own health with important lung cancer screening information. The new Penn State Health Cancer Center at Hampden Medical Center on the West Shore just opened its doors. This state-of-the-art facility brings together expert physicians, innovative technology, and personalized treatments, all in one convenient location on the West Shore. Take a look.
This cancer center gives the patients access to high-quality care, Penn State Health Care. It gives them access to all the things that motivate us to do well at what we do. So the innovation, the research, the best treatments that are available. This is the promise we're giving to the West Shore, that we're going to give you the best that Penn State has to offer. And it's a commitment. It's a commitment and a promise on the same hands.
It's such a wonderful opportunity to be part of opening this cancer center and allowing our patients to experience this beautiful, supportive, caring setting.
Personally, I'm very excited because we'll all be under one roof. Medical oncologists, radiation oncologists, the surgeons, will all be able to communicate with each other very closely, work with each other closely, and that would really enhance patient care. For example, if a breast cancer patient comes in, she'll be able to see a breast oncologist, radiation oncologist, and us at the same time.
That collaborative ability to walk down the hallway and talk to a radiation oncologist or to a medical oncologist or talk to the breast surgeons, to have multidisciplinary clinics where patients' cases are reviewed at the same time. That's so important.
This is a very convenient place for the patients, and it's more than just the convenience of a shorter trip. Patients, just by the nature of the cancer, are going to have a certain amount of fatigue, mental and physical, and the treatments themselves will add to that. So if we can at least take off that bit of mental and physical fatigue of having to travel far day to day, that's very important.
Over here at this desk is going to be someone who greets the patients when they walk in. The greeter will kind of help direct the patients to the proper registration spot. So first we're going to go to medical oncology.
The lighting, the artwork, how the spaces flow, I think they're all meant to make patient care better. And I really think this will give patients some comfort during their difficult cancer journey.
Patients who are undergoing cancer treatment spend a lot of time in the infusion space, depending on the treatment regimen their physician has prescribed. So it's really important that the space that they're in is comfortable for them, first of all. It's the caring environment, the people, the staff, the nurses that are taking care of them. But just the aesthetics of this space, we're so excited about it because it's very calming. Having the windows with the natural light coming in is also important for people. Each time they come, it's comforting to have that space to be in.
This is the CT simulator. It's a 4D CAT scanner. When you treat patients with radiation, you find the target on the scan, but you use this scan for what's called planning. They take the images and manipulate them in such a way where they can determine what radiation dose they need to what areas of the tumor to give the maximal effect.
The newer equipment will have the capability of providing some higher tech treatments. Most of the equipment we work with works with very high precision 3D computer modeling of the target tumor as well as the patient so that we can apply the treatment where we need it and spare as much normal tissue around as we possibly can.
This is the control room. This is where all the controls for the linear accelerator. The linear accelerator is the machine by which we treat patients. This is the TrueBeam. The TrueBeam is the product we're using to deliver the radiation therapy. It's state-of-the-art equipment. It can treat a lot of patients in a single day.
The technology we have on a machine like this allows us to be more precise in treatment, and in certain select patients, particularly patients with smaller tumors, patients can be treated in less time very often, fewer treatments, but also in certain situations, you can even have better outcomes with using this type of treatment.
The care for cancer patients doesn't stop after finishing treatment. So even beyond treatment, we try to constantly provide support so that they get back to their baseline. It's just not medications, giving them medications or chemotherapy, but we also constantly keep evaluating what their emotional and social needs are.
The bell, in a lot of ways, is to memorialize the end of something or an accomplishment that the patient's made. Something to say, yes, this wasn't a needless endeavor, that we've gotten through it, and I'm stronger for it. I've reached a milestone.
We need to make sure that the patient understands what the follow-up plan is so that they are anticipating what's going to happen next. Because we celebrate when the treatment ends, but obviously surveillance is very important, and how does that patient move forward?
We made a promise to a lot of different groups. We're fulfilling that promise, and the patients on the West Shore are going to benefit from it. To me, it's the concept of it. I just love it. I think this is the best thing that we've done.
Well, joining me now is Dr. Marc Rovito, Vice President and Lead Physician with Cancer Services at Penn State Health. Why was Penn State Health Cancer Center at Hampden Medical Center created, and what does this mean for the community?
It was created for a number of reasons. Penn State has always been committed to this community, and these counties, Cumberland, York, Perry counties. They've always wanted to show that commitment. Several years ago, we were able to combine our services with some really high-quality physicians in the area, providers, staff. So from medical oncology, breast services, radiation oncology, this is our desire to fulfill that commitment, that promise to the community, to bring it all under one roof, which is really optimal care. So that's kind of the purpose.
Tell me more about that, bringing it all together under one roof.
Yeah, oncology, like other fields in medicine, but oncology specifically, really doesn't happen in sequence. You don't see one doctor, then you see another. It really should happen as a multidisciplinary event. Right, so a patient has a cancer, usually get all your doctors in one place talking about how the care should be delivered, whether you have surgery, you should chemotherapy, or whether you should have radiation first. That is that kind of interdisciplinary. It's that kind of give and take, in a sense, really treating the patient the best way possible. And that, in one location, makes that happen.
It's a team.
It's a
right?
team.
It's just a team. It's a team.
And it brings that physical location brings that team together.
Yeah, that's terrific. And for the patient, I mean, that's so comforting,
exactly.
I think, so comforting. We're so fortunate to have Penn State College of Medicine right here in our backyard. What does that mean for, cancer research and advancement with Penn State Health? Yeah,
the College of Medicine, the Cancer Institute, that's really kind of that's really the groundwork, right? So everything we do comes from things they do. That research, those clinical trials, having that in our backyard, being able to extend that not only physically to the West Shore, but physically to this area, but also have that ability to refer really complicated cases, difficult cases that will require a much higher level of care to Hershey, that proximity. We're very fortunate to have the College of Medicine that can provide that kind of expert and ingenuity to cancer treatment.
And now this new cancer center, right? And how does this really position Penn State Health in terms of the future and advancing cancer care?
Yeah, so advancing cancer care means giving them the highest quality of care to the patients in the area where they are. And that's what this is, advancing the cancer care for these folks, giving the high quality care, but also giving that access to those clinical trials, that research that people want to know about, people want to be part of. And having that integrated care is the hallmark of that. It's the bottom line.
For such a long time, we've had this terrific medical center in Hershey, right? And now it's spreading out. Why do you think it was so important to bring these services to the West Shore?
Again, it fulfills the commitment. It fulfills the promise. So the promise and the commitment is, part of our credo is to provide the best care and to have patients understand Penn State Health is the best care you're going to get. And bringing it to the West Shore, having it physically here, is really ideal, and it fulfills that promise and commitment.
I think it's very comforting. I think it's terrific. Thank you so much for being on the show
My
with
pleasure.
us today.
Thanks for
Congratulations on the opening.
Very good. Thank
If you would like more information about the new Penn State Health Cancer Center at Hampden Medical Center, scan the QR code on your screen or call 877-654-5956. Now let's check in with Donna Kirker-Morgan. What are some of the questions being asked, Donna?
Amy, we have a wide range of questions coming into our web chat at this time. We have Dr. Rajesh Surapaneni, hematologist, oncologist at Penn State Health Center. Cancer Center has been busy this evening answering questions. We're going to go to the first viewer question, Doctor.
Sure, Donna.
And this viewer is asking, I've heard more people talking about genetic testing for cancer. Who should think about getting it, and how does it work?
Cancer genetic testing has become an integral part of cancer care. So it not only helps patients identify their own risks of developing various kinds of cancers, but it also gives some guidance to their families in terms of assessing what cancers they are at risk for and what kind of screening they would need. So a lot of things in patients' history would give us some guidance in terms of who might need cancer genetic testing. For example, if there are a lot of family members, this would be obvious. Multiple family members with certain kinds of cancers. For example, breast cancer, colon cancer, endometrial cancers, prostate cancers, among multiple family members would be a trigger to do cancer testing. Of course, other things would be if somebody develops cancer at a very young age or has multiple cancers or certain kinds of ethnic backgrounds like Ashkenazi Jewish background might be more predisposed to have BRCA1 and 2 mutations. So nowadays, not only those indications, but we're also using cancer genetic testing as a means of deciding what kinds of drugs we have, what kind of treatment options we have. So for all these reasons, we are doing cancer genetic testing. And of course, we send a lot of these patients to who would benefit from cancer genetic testing to counselors, genetics counselors, who do an excellent job counseling them for what the pros and cons are for doing these tests and what the consequences are.
So important to get that testing because it
Extremely.
plays out in all kinds of treatment. This question is from a viewer, and they say, if I don't have a family history of cancer, do I still need to get regular cancer screenings?
My answer is absolutely yes, because for a simple reason, for a majority of the patients who develop cancers, unfortunately have no family history or prior history of cancer. So it's very important that everybody get their cancer testing done, age appropriate and sex appropriate, so they should talk to their family physicians about the right cancer screening.
Welcome back. Joining me now is Janet Cady, Lung Cancer Screening Program Manager at Penn State Health, and Dr. Michael Evans, Hematologist Oncologist at Penn State Health Cancer Center. Let's start with you, Janet. Why are screenings such an important thing to do?
So health screenings are meant to identify problems when they're at their earliest and potentially most treatable stages. And so having those health screenings at the age appropriate and sex appropriate times is really vital.
Absolutely. And Dr. Evans, when cancers, say like lung cancer, are detected early in those early stages, how does that ultimately help the outcome and factor into the treatment plan?
It's an enormous factor into the treatment plan. When they're diagnosed early, we have more modalities at our disposal, and by identifying a tumor when it's early and it's smaller, the chance of cure is much higher using those modalities.
Very good. And here's an opportunity, right? Penn State is hosting lung cancer screenings on November 8th. We're going to put the information right there on the screen. That's how you register. Who qualifies for this, Janet, and how do they do that?
So patients between the ages of 50 to 80 who are current smokers or have smoked formerly within the last 15 years and have a pack history equal to 20 years, which is the equivalent of 1 pack of cigarettes a day for 20 years, are eligible for this screening. The way they get registered is to call 866-PSU-LUNG.
What can somebody expect if they come to the screening?
Yeah, so super easy, painless process. They come in, our technicians will take them back to the scanner, they lay down, they have quick in and out from the scanner, no IVs, no nothing. They're in and out of the building usually within about 10 to 15 minutes.
Of course, anybody who has screening done hopes for, a no cancer diagnosis, right? But if somebody is diagnosed with cancer, what are some of the newest and advanced treatment options available to them?
We have, again, multiple modalities, and they're all available at our cancer center. So starting with surgery, radiation, chemotherapy, immunotherapy, molecular targeted therapy, all of these things are utilized to treat cancer, whether it's early stage or late stage, and it's all factors into the particular patient and how we can best utilize them to hopefully cure them, which is the goal of screening, is to catch them early so that they're curable and we can get the treatment behind them.
So the message today is get screened so you can catch things early. That said, I know some folks just don't want to. They're hesitant, they're nervous. What can you say to those folks?
So first things first, this is an amazing question because so many people struggle with this and they are scared and they are unsure. First of all, I would really encourage them to talk to their doctor. There may be other options for screening modalities that are available, and they may be able to talk those through, because remember, the point of those screenings is to find something when it is at its most treatable stage.
Very good, very good. Thank you so much. Great to have you on the show. Now we're going to turn it over to Donna Kirker-Morgan. She's here with our web chat. What kind of questions are coming in now?
All kinds of questions are coming into the good doctor. Dr. Surapaneni is a hematologist oncologist at Penn State Health Cancer Center, and this viewer is asking, how can I better support a loved one who is going through a cancer treatment? It's got to be very, very difficult for both people, especially the cancer patient, but the person that's living with them, how can they help?
Donna, this is a pretty broad question, but there are a lot of things that families can do for their loved ones during this difficult journey. First and foremost is just being present there for them, just listening to them.
Yeah, so important.
Is extremely important. You don't have to fix things, you just need to be there. Of course, physical help, like driving them to appointments, helping them with food, financial help, those kinds of things would always be welcomed by patients. I see that all the time. And of course, being an advocate, a staunch advocate, is always helpful, because a lot of times I see when patients are in the office, information is coming from different directions.
So fast.
So fast. And they have, they can only digest so much information.
So take notes maybe?
Take notes. And just having that extra person there in the room to digest that information and, ask relevant questions, do the appropriate research is always helpful. So just be there for the loved ones, and that's the first thing you can do.
And we have this next question. What advice would you give to cancer survivors who want to stay healthy after treatment?
I think probably the best way to tailor that care after cancer treatment would be to enroll in an appropriate survivorship program.
Oh, great idea.
Because a lot of times if the patients, as they transition from a curable cancer treatment to a survivorship program, they get appropriate information from what would be appropriate for them. It's tailored to them. Either it could be in the form of nutritional needs, exercise programs, age-appropriate cancer screening, or screening for that particular cancer they dealt with and had treatment for, to catch things early if that cancer were to come back. So I would strongly recommend, joining into or enrolling into a survivorship program.
And I know Penn State Health has quite a few survivorship programs. I know we're trying to promote the prostate cancer survivorship program. We're going to talk about that on November 3rd on a similar program.
Absolutely. We have survivorship programs for most of the cancers, and we try to educate and transition patients, smoothly into these programs.
Thank you, Donna. Joining me is Dr. Lily Shah. She's a hematologist oncologist at Penn State Health Cancer Center. This new cancer center, it was truly designed to treat the whole person, not just the cancer. What does that philosophy truly mean to you and the team?
We realize that cancer is such an individual journey. Each person who receives a cancer diagnosis, it's very different, and we really try to listen to each person individually and help them along their way, not just physically but also emotionally.
And the new center itself, it's really lovely, right? There's artwork, there's open spaces, and how does that really create that healing atmosphere?
So I had the privilege to be part of the art committee, which was a group of clinicians, staff members, and patients, and we selected pieces of art from local artists in the community to tap into the talent that is here right amongst us. And these pieces of art are posted in, they're framed and up in patient waiting rooms and hallways and all the exam rooms. There were also 4 larger pieces of art that were commissioned for the waiting rooms of the medical oncology, radiation oncology, breast center, and a foyer as well.
That's incredible.
It's really beautiful. It was so nice to be, we had a reception for the artists, and to see the artists walk around, see their pieces of art in the exam rooms. They didn't know where they were hung up, and so just to see their joy and to hear the artists, like the thought that they put into their pieces, to really add to the healing environment of the Cancer Center. It was very special.
So special, so special. And you created the space, and it focuses on comfort and connection and collaboration for patients, for their families, and for the staff too. Why was that important?
Yes, there's so much time people have to spend to go through their own cancer journey. Each person that walks through our doors, we want to make sure it's a healing environment from the moment they walk in. Also for our staff, it can be emotionally very taxing too. So we want this to be very collaborative for everybody, and overall to be a healing place.
So it's this wonderful healing place, and the team all works together across multiple disciplines to really meet those physical needs, the emotional needs of patients and their families. As we mentioned earlier, it's not just about the cancer itself, right? So talk to me more about that team and that collaboration.
Yes, so when I speak with patients, their experience at our cancer center with our staff, I mean, they will mention to me how they love the person who checked them in, such a positive atmosphere, the nurses who treated them for all these years. I mean, everybody, our phlebotomists in the lab who draw their blood. I mean, it is really just a privilege to be at this place and working with a team of people who really have the patient and their journey first and foremost.
And just talking with you today, I see how much you truly enjoy this spot. That must mean a lot to you as a provider.
Yes, it does. It's very humbling to be an oncologist, to have this place, and just to have this role in somebody's care. It really, I just can't say enough. I mean, it's very special.
It is so special. It's so special. And cancer care, I mean, on the behalf of nurses, doctors, I mean, it really takes a lot of resilience. And how do you feel that this new cancer center really inspires hope and brings something new, and fresh to the community?
Right. So we're hoping that bringing the cancer care close to patients and their families, we hope that it makes it a little bit easier for them as well. It is a long journey, and so we just want to kind of be present for them as much as possible. So from our staff, from our hearts, from just having like the artwork on the walls and the soothing paint colors, I mean, everything was really chosen intentionally to make it more of a healing environment.
You had mentioned that every cancer patient's journey, it's different. Every diagnosis is different. But I think fair to say that when somebody gets a diagnosis, reactions are pretty that is a really scary thing. What can you say to encourage people? Like, yes, you're going to have that momentary fear, but to encourage them that we can do this.
Yes, we have so many more treatments that are available now. Our screening techniques have found cancers earlier, so they are more highly curable. More research needs to be done and more progress needs to be made, but we have come so far, so we're always hopeful that tomorrow will bring another step in the right direction.
Just terrific. Lovely having you tonight. Thank you so much, and congratulations on the new center. We would like to thank the providers at Penn State Health Cancer Center for joining us tonight, and to you, our viewers, for sending in your questions. If you would like more information about the new Penn State Health Cancer Center at Hampden Medical Center, scan the QR code there on your screen or call 877-654-5956.